Has the toilet become your best friend? Do you need to know the location of every single bathroom before you go anywhere? Did you go into a complete meltdown and panic because the supermarket sold out of toilet paper? Then chances are you've probably been diagnosed or diagnosed yourself with irritable bowel syndrome, or IBS as it's commonly referred to. It's a name that gets thrown around a lot. Many patients come to see me already with this diagnosis. They've usually been to see many other medical professionals prior to seeing me and are often frustrated because nobody knows what's wrong with them. Nearly every patient has had the same experience. Chances are you've been asked to provide a stool sample. You didn't think I'd show you a real one. It gets sent off to the lab and checked for any nasty bacteria or parasites that may be causing your symptoms. The results may come back with nothing, or the doctor says something, but you don't need to worry about it. Time goes by and you're still suffering from the same horrible symptoms. You go back to the doctor, you're referred on to a gastroenterologist for a colonoscopy. My patients often ask me if I agree with this procedure, and my response is always the same. Any form of test that can rule out a potential disease is usually a good test. It is especially important if there is a family history of bowel cancer, and also if you eat foods that are on the World Health Organization list as foods that are potential causes of bowel cancer, such as processed meats and red meat. If you are at risk and it is suggested to have this procedure, then go ahead, because if you catch bowel cancer early, there's a pretty high success rate. Another condition which can often be mistaken for IBS is diverticulitis. This is when the little pockets of diverticuli get infected, and it usually requires antibiotic treatment. There are also the inflammatory bowel diseases such as Crohn's and ulcerative colitis. These are completely different from IBS. So what are the symptoms of IBS? Well, there's pain in the abdomen, cramping, bloating, to the point where you feel like a balloon is blown up inside you. And the only way to get rid of it is to pass wind or have a stool movement. There could be mucus in the stool, nausea, recurring episodes of diarrhea or constipation. You may even alternate between diarrhea and constipation. You can also be more dominant, one way or the other. You can have a mixed pattern or no real pattern at all. Feeling discomfort that your bowel hasn't fully emptied after passing a motion, these are all signs. But the most important thing to know is you don't have to live with it. I have helped so many patients get back to doing the things they love without these horrible interruptions. Patients who thought that this was their new normal, and it just isn't the case. Everyone is different and has a different reason for their IBS symptoms, which is why there's no magic pill to fix it. But work with me to find out your causes of your signs and symptoms and let me help you fix them. So what is a normal stool? Well, normal can be different for everybody, but generally speaking, a normal stool is one that's formed, not hard, contains no blood, is passed easily without any pain or cramps. Additional factors to consider when it comes to a stool include colour and smell. The colour should ideally be a mid to dark brown colour. If it's light brown, clay or mustardy colour, or even a black colour, then this is a sign for further investigations potentially. Also connected to IBS is the smell. There should be no odour in the stool or in any gas that you eliminate. If there is a smell, this is a sign that the digestive system is struggling to break down the food that you're eating. What are the possible causes of IBS? Well, it's called a syndrome by the medical profession because it's defined as a collection of symptoms with no known cause. But in the world of naturopathy, we think differently, and we can see some causes. Toxins. Toxins are considered to be the poison that make changes in the body. They can come from chemicals, food, environment, including people around you, and even how you talk to yourself. Everyone's underlying cause may be different. However, there are a few major contributing factors. Number 1, the imbalance of acid levels in the stomach, affecting proper digestion and defending you from the outside world. Number 2, eating foods that are affecting the lining of the intestines and the liver, leading to digestive issues. Number 3, infections, viruses, parasites, general imbalance. Moving on to number 4, this is where the action happens, in the large intestine. This is where your microbiome is, and they can be potentially harmful as well as helpful. So you need to have the right balance. Number 5 is one of the most important factors, which is often forgotten or overlooked, and that's the connection between your gut, the microbiome, and your brain. There's a large body of research that has supported the presence of a pathway of communication between your gut microbiota and your brain. And it's now thought that through this pathway, the microbiome can affect your behaviour, modulate how you think, how you set your goals, what your mindset is. Well, this is called brain plasticity. There's also research to show that there's a connection between your gut microbiota and cognitive function and aging. This is a major bonus of keeping your gut healthy. It may keep you feeling younger for longer. Another area included in the gut-brain connection, this is if you're triggered by images of junk food, such as burgers and pizza, your mind switches away from healthier choices, and you need to eat junk right now, whether you're hungry or not. Well, this is one of the major areas that I work on with my patients, because your subconscious brain is now in charge of your decisions.